Have you or your loved one heard about a DNA CPR form, also known as a Do Not Resuscitate order? You might be wondering what this form means, how will it affect your health and your management and your care, and is it the right thing to have for you? Well, this is a topic which causes a lot of confusion and can be quite distressing, and chances are it may not need to be. So I'm going to try and clarify all this in this video for you, so by the end of the video you can feel much more confident to make a decision about what's best for you or your loved one. I think at first it's important to clarify what CPR is. So this is cardiopulmonary resuscitation. We all think we know what it means. We've seen it in the movies and TV shows where someone collapses, someone else bounces up and down on their chest, and then that person starts coughing and spluttering and comes to life. Unfortunately, real life CPR is nothing like this. It can be really quite gruesome. Through the chest compressions, we often break the ribs, you can even have punctured lungs. It can be quite distressing for anyone who's watching. And also, the survival rates aren't good. So about 10 to 20% of people, we do get their heart started again. But even then, they may have brain damage. They may not necessarily ever get back to the quality of life they had before. And for people who've got long-term health conditions or cancer, then that can drop to about 2% survival rate. So not great odds for those sorts of people who have other health needs. There are kind of three conditions where CPR is most likely to be successful, and that's for people who are otherwise healthy. So their heart has stopped, usually the heart's the first thing to have gone, and otherwise their organs are healthy. So they've got healthy lungs, healthy kidneys, liver's in good nick, and we can restart the heart. The second thing that needs to happen is that someone's at hand who knows good CPR. And the third thing is that you've got quick access to equipment such as a defibrillator. So if all those three things are in place, then you've got a much higher chance of surviving. And of course, if those three things are not in place, then you've got a much lower chance of surviving. And that's when we need to think that if it might be best to protect that person with a form that says, do not even attempt to bring this person's heart back, because sometimes we know that this is just an ordinary death. The person's come to the end of their life, their body's already shutting down, and really the heart's the last thing to go. So by attempting to restart the heart, we're going to fail. Not only is it going to fail, but it's not going to be the right thing to do for that person. So in these instances, we think about writing and signing a DNA CPR form, which instructs the healthcare team not to attempt resuscitation.
Okay, so when might someone have one of these DNA CPR forms? Well, there are three reasons. Firstly, it may be that that patient has decided for themselves they know they do not want resuscitating. A lot of people make this decision, and we say they've got patient autonomy, so they're taking control, they're making decisions about what they want at the end of their life. The second reason is that the patient and the family and the clinical team have decided that due to health problems, it's unlikely that CPR is going to work, so it's in the patient's best interests to have a DNA CPR form written out. The third reason is that the clinical team have made a decision that it's a futile thing, so it means it's not going to work, and we'd rather the patient had a dignified death. And usually this is still done in conjunction with the family, friends and the patient, if wherever possible. In rare circumstances, the clinical team may disagree with the family and the family may disagree with the clinical team. If that happens, then you can get a second opinion from another doctor. There are a few points that people get quite confused about when it comes to these forms, and I'd like to clarify those. Firstly, and really importantly, people worry that if their loved one or themselves has a DNA CPR form, it means that they will no longer receive the proper care and healthcare needs that they require, and this is not true. So this form only relates to when your heart stops beating, that you will not have attempted CPR. It doesn't mean that if you have a chest infection you won't get antibiotics, or if you're in pain you won't get pain relief, if you need to go to hospital you can. So it only relates to that one thing, and all other aspects of care continue as normal. The second thing that I would like to clarify is that there shouldn't be any blanket decisions made about these forms for any group of people. It should always be made on an individual basis, based on that person's healthcare needs, their problems, what they want, their family's decisions, their loved ones. So never a blanket decision. The final thing I just wanted to clarify is that a lot of people, when this is first brought up, panic a bit and think, oh my gosh, did the healthcare team think I'm going to die? Not necessarily. It's actually a good idea to start thinking about this well in advance. It may be that we know you've got chronic health problems and that it's unlikely that CPR is going to work. So it's a good idea to have a form done. And it may be that you won't die for years, but at least you've got the form done, you don't have to worry about it anymore, and you can actually get on with living. I'd like to also speak to you about something called advanced care planning. So this is where we encourage patients, such as yourselves, to think about what you'd like when it comes to the end of your life. Now, we're not very good generally about talking about death, are we? We often find it a bit difficult, it's quite stigmatised. We don't even often say the word death and dying. We say things like passed away. Well, actually, we would argue it's a good idea that we should talk about death some more. I mean, that sounds macabre, doesn't it? But it's really important that people can make their wishes known. So I used to work in a hospice, and people used to write things down and they'd say things like, well, I'd like a pint of Guinness, before I go. Or I'd really want my dog, Maisie, to be with me. And people have all sorts of interesting things they want to happen, and we would do our best to make that happen. Pretty much always managed, actually. So it's really important for people to be able to have their say when it comes to the end of their life. There are different ways that this kind of ACPs can be dealt with and kind of formalised. A lot of places now use something called the respect process. So this is a way of documenting what your thoughts and wishes are, and it can be about your treatment, it can be whether you want to go into hospital or not, and it can be discussed with the family so everyone's quite aware. There's something else legal called the Advanced Decision to Refuse Treatment, the ADRT. So this is a bit different because it is a legal document. It just needs signing and things like that. And this is when patients know there is treatment that they do not want to have when it comes to the end of their life. When they're not able to make a decision about that, but they know now that they don't want that to happen. So for example, someone might say, I've got terminal cancer. When I have become unconscious and am unable to swallow by myself, I do not want artificial feed and fluids. So people write things like that. And so I would just encourage everyone to think about it for their loved ones, for themselves, and when the time is right, to start documenting it and sharing that information. So what about the form itself? So you will be given an actual form when you have got a DNA CPR. If this is from hospital, then you'll be brought home with you. We need to make sure your GP has a copy of this and they will share it with the wider healthcare team. You also need to make sure that your family and loved ones know where this is kept. Often it's like in the top drawer of the kind of cabinet or in the kitchen. And it will be reviewed. So every time you go into hospital, for example, or if there's a change in your healthcare, then it's a good idea to just check that it's still right or whether it exists or not. A good death. Now that's a strange phrase, isn't it? We're not really used to talking about death. As I've mentioned, it's stigmatized. But actually, this is a phrase we're starting to use when we're thinking about trying to make sure that the end of somebody's life is comfortable and that their wishes are taken into account. Unfortunately, as a doctor, I've seen lots of deaths that are not good deaths, and I've also seen deaths that are good. And the difference it makes to the family is immense. I'd like to share with you an example of a patient recently who we knew had cancer and we knew was going to die. They'd made wishes that they wanted to die at home, and they did. They died in their own bed with the person they loved the most holding their hand. And when I went out to see the family, they were so grateful for the care that their loved one had received and that they died pain-free, content, calm, peaceful. And if that patient hadn't have had a DNA CPR form, then it might have been that the family would have rung 999 and the paramedics would have come out. And typically they will always try and do CPR unless there is a DNA CPR form. There can be some exceptions to that. And then if this patient had have had attempted CPR, it would have been horrible for the family. The outcome wouldn't have changed. This patient would have died anyway. But it would have taken away the opportunity for a dignified death, which was so important to the patient and so important to the family. So this idea of a good death is one where the patient themselves has had an opportunity to have a say in what happens right at the end of their life, and their loved ones are aware, and it's just much more peaceful, and it means that they can end their life peacefully, and the family have much more comforting memories to go on. So this is such an important thing to talk about. I hope you've learned a lot in this video. Do share it, because we should be talking about this more, shouldn't we? I hope you've learned that as well, that let's not be so stigmatized to talk about death. We all make birth plans when we have babies, so why not think a bit more about how we want things to be when it comes to the end of our life? Have a look at my YouTube channel. I've got lots of other videos you also may find helpful. Thank you for watching.